doing a peel today on Kimberly. She's had a problem with acne for some time and tried a number of preparations, haven't you, Kimberly? Tried a lot of... Name some of the things that you tried that haven't worked.
I've tried the Tetrazole antibiotics.
Yeah. Were you on them for quite some time?
About a year and a half.
Oh dear. So now we're going to try with peels, a combination of different things. We're going to try a peel today. Quite bad in this cheek area here, quite active, and we discussed this before and I said that I thought you slept on this side and you said yeah you do. So that's why this area is broken out a bit more. The area that you sleep on, this is what tends to happen. This is the prep solution I'm using. I'm just taking all the oil. I've cleansed the skin twice and also I've done a scrub. Now just breathe in, spit, hold your breath and breathe out. That's a horrible bit, isn't it? And I'm preparing the skin for the actual chemical peel, which is glycolic. So this is just stripping the oil out of the skin. That's what I'm doing just now. There's a little bit of acne at this area here too. The cheek area is quite clustered, quite blocked. Not bad, but a little bit blocked here and a little bit blocked up here. I'm using a glycolic peel, and what is actually happening is the glycolic, I'm going to put it straight on, it's like a gel form, okay, I'm going to put it straight on to the area, like all over the face. Her neck's absolutely fine, she's just a young girl. What age are you, Kimberly?
19.
19. That's a very common age to have this as a problem. So I'm massaging it in. I like to work with my fingers doing this, but you know, advisable if you've got great nails or whatever, it's a good idea to wear disposable gloves, definitely. I've just been doing it a long time, so I like to work straight in with the fingers. Paying particular attention to the areas that are blocked. Really massaging this in. If it was our first peel, I would really keep it on maybe 5 minutes. What I'm looking for is to see the peel pinking up. What's actually happening is the glycolic in this gel is breaking up the bonds that hold the dead skin cells together. The dead skin cells are blocking the follicles, and that is unfortunately how acne happens. It's as simple as that. The oil flow is coming out the sebaceous gland up the follicle, can't get out because there's dead skin blocking it. The oil backs up, backs right down into the follicle, and then usually starts to get inflamed, turns into a spot, has acne bacteria there. And with doing the peel, the great thing about this is it's taking away, you know, if you think of those bonds that's holding the dead skin together, it's breaking them up, allowing the dead skin to come off at a quicker, much quicker rate than Kimberly's doing it herself. So I'm really unblocking the skin big time with this, and that's going to help the oil to flow out and not block and cause pimples. That sounds good, doesn't it? So I can see the skin pinking up just now. Everybody always worries about chemical peels, that you know, they're going to leave you with a big red face and it's going to be peeling off in, you know, strips of skin, and that's not what happens at all. For acne, peels are a fantastic treatment to unblock the skin. So I'm working this in. It's been on the skin now, it's looking like for about 2.5 minutes. How does it feel?
It's alright.
Does it feel tingly?
Yeah,
How tingly? On a scale of 1 to 10, how tingly?
about 5.
That's alright, isn't it? So it's not uncomfortable, is it?
No, it's fine.
I'm not using heavy pressure here. I'm really quite lightly working right into the skin and over the blocked areas, paying attention to those areas. And I find that when I'm constantly moving on the client's skin, it's better for the client rather than leaving the peel on. You're nodding your head, yeah, Kimberly. Don't you think that keeps your mind off it?
Yeah.
Because I'm working down it. Because the glycolic peel does feel tingly on the skin. So this sort of takes away from that feeling for the client, makes it a bit more comfortable, definitely. You know, always err on the cautious side. If you see I'm not going over the lip area here, don't go near the lips because you can make the lip area really dry up, so be careful when you're doing the lip area. Obviously do the upper lip, but nowhere near or on top of the lips. And if there was any problem under here, I'd be working more, but there is not a lot of blockages under here, which you can get with acne. You can get a lot of blockage along the jawline, but there isn't in this case. So I reckon what we do is if we did a peel literally every week for probably 6 weeks, I would really have this acne more or less gone for sure. That's what I want to achieve here with Kimberly's skin. I want to get rid of it and get her back to normal skin. It's fine actually when I'm looking at it, still not pinking up too much, so I'll leave this on for a little bit longer. And over the next really 5 days, the dead skin's going to come off a much quicker rate, unblock. So it's not just working, the peel's not just working while I'm doing it, it's going to keep working when Kimberly leaves here. Over the next 5 days, the skin is going to keep coming off. There is no downtime with this. After having the peel, literally 10 minutes after having it, I can put on a mineral makeup. That is really the way to go. Bare Essentials mineral makeup is really good because it's got zinc oxide in it, and the zinc oxide heals the spots. So, you know, I like to do the peel on the client, and then once I've done the peel, put on a very, very light moisturiser on the areas that are dry. In Kimberly's case, there is no dry areas on her skin. Her skin is not dehydrated at all. So she really, in this case, I wouldn't be putting moisturiser on, but I would be making sure that she had an SPF on. Now the mineral makeup, Bare Essentials, has got the SPF in it, and that's going to protect her skin. So, as you see, it's not erupting, it's fine. It's absolutely just getting into the skin. It's not going far too pink or anything like that. People think it's going to happen with a peel, and this is going to really have an effect on her skin today. When I see her in a week's time, it will be clearer because it wouldn't have blocked up as much. After I do this peel, I then would spend some time checking and unblocking some of the pores that are easily unblocked. I would do that manually. You can see it now drying up around the area here. To activate that a little bit, I just put my hands in some water and do this for the last little part. It just activates it again, the peel, because it starts to dry up. Feel a little bit tingly then? again. Yeah, just when I do that, it feels a little bit tingly again to the client. Just activates it again, the water. As I say, you don't need to use, you can put on disposable gloves, and I would advise I would advise you to have disposable gloves on when you're doing these clients. I just like to get into it with my fingertips, but it's not necessary. Just personal preference. Ready to take the mask off, or the peel off. I'm using mitts which have been soaked in lukewarm water. Okay, and I'm very gently going over the whole face. What we'd be hoping is that we're going to clear this problem up in really 6 weeks. I would be hoping to get this completely under control, and then having Kimberly just phone me when she feels that it's a little bit of outbreak. But I'm going to go through, which we've already talked about, her own skincare at home, what she should be doing, and the most important thing is she's got to be cleansing properly and using face cloths. The face cloth, just like what I'm doing just now, acts like an exfoliator. So I have recommended Kimberly to use a cleanser with glycolic in it, and use a cleanser once in the morning and twice in the evening, and take it off with a face cloth. And I'm advising you, Kimberly, to use a face and body scrub every day till I see you next week, and then gauge that. All I want to happen is that you're going to be unblocking the skin all the time, and therefore ensuring the skin is not blocking up. Now, the face and body scrub I'm seeing every night until I decide that she can go back to a couple of times a week, but just now I want to, the dead skin cells that are coming off, I want to ensure that they're coming off at a good rate. The skin scrub, I don't want you doing that tonight because that's too much in the skin. If you can leave it for 24 hours and then go back 24 hours later and use your skin scrub, okay? And that's us finished the peel. How does that feel?
Fine.
Yeah, good. Good, a lot cleaner?
Yep.
Yeah, yeah.